Michelle Ortiz. I'm the PA student that's going to be assisting with your care today. Can you go ahead and confirm your name and date of birth for me?
Yes, my name is Eloise Bridgerton. I was born on the 7th of July, 1996.
Okay. And how would you like to be addressed today?
Eloise is good.
Okay. And then my pronouns are she, her. What are your pronouns?
She and her as well.
Okay. Well, I know that you got admitted today for an accident that you had, but we also noticed in your labs that you had some elevated levels of alcohol in your system. So I'm just here to talk to you a little bit more about substance abuse with you, and just to just get an understanding better of your situation, kind of like what happened, and if you are struggling with substance abuse, like maybe we can talk a little bit more about that. If you're okay with proceeding with today's visit, is that okay?
Yes.
Yes, awesome. Okay, so we're gonna go ahead and get started. I'm going to be making note of the patient's general appearance and vitals. But okay, so I do want to talk, like I said, with you about your substance abuse. So, do you drink alcohol or smoke tobacco or do any illicit drugs? Can you tell me a little bit more about it?
I do drink quite a bit of alcohol. Not really, I don't really smoke tobacco, or I don't do any other drugs, just alcohol. And I'm here on a very long extended vacation from Britain. And I'm used to drinking at home. I mean, you can drink at age 16 there and it's fine, but I guess I just kind of have fallen into more of a party lifestyle since I've been here. I've been drinking quite a bit more than I had before. I suppose I just didn't know how bad it's gotten until my accident last night, unfortunately.
Yeah, thank you for sharing that. So, you mentioned that you have picked up more of a party lifestyle. Would you say that you drink every day, or how often do you find yourself drinking?
Most days, yes. Especially after work. I do work a 9-to-5 desk job and just blow off steam with my coworkers, and we'll go out either to a bar or to a club, and I'll have, it depends on the day, but I'll have 4 to 5 drinks.
Okay. And so is it just more of like liquor that you drink, or like what other types of alcohol do you drink?
It's really just vodka drinks, vodka cranberry.
Okay.
It's my go-to, yeah.
And you mentioned that you started that in your hometown you can start drinking at an age of 16. Is that when you started drinking, or at what age did you start?
I would have a drink here or there, because you can have, the beer and the wine at 16. I didn't really start drinking like the hard liquor until a little bit later, and then when I got here, I guess I just fell in with a group at work that goes out a lot, and so that's kind of what I've been doing as well. But I did, have the drink or two occasionally when I was younger. It just, since I've been in America, it's really gotten bad.
And when did you come to America?
About 8 months ago.
Okay, so do you feel that you drink more now than you did 8 months ago?
Yes, yes, unfortunately. I would say over the last 2 to 3 months, yes. Almost every day.
Do you ever find yourself needing to drink more to get the same effect?
Yes, yeah, I think so.
Okay. And if you could put a quantity to the amount of drinks that you have on just like a regular night, how many drinks would you say that you drink?
If I'm going out after work, I'll probably have 4 double shot cranberry vodkas.
Okay. Do you have any sort of triggers? I know you said that you recently moved here less than a year ago, but is there any triggers at work or any other reasons that are causing you to drink? Do you have any pressure from your friends or from family?
I wouldn't say pressure, no, but my job is very boring, but I like my coworkers, so it's kind of the, we do our 9 to 5, it's awful, and then we go out, and that's the fun that we have, so I've just fallen into that pattern.
Right, okay. So, now I'm just going to ask you a couple of questions more about your family and just like your culture practices. Is there any history of substance use in your family?
Well, Yes, I did have an uncle that unfortunately passed away because of a heroin overdose. It was quite some years ago, but yes, I suppose that counts. And then my grandfather had a bit of a drinking problem on my mother's side. And so he didn't do very well from that, had some liver issues and passed from that not too long ago. So yes, now that I think about it, I do have some of that history in my family, yes.
Well, I'm so sorry to hear about that. I know that can be really difficult. Would you say that there's like specific cultural practices or stigmas regarding alcohol in your culture?
I mean, we Brits like to drink, right? So it's not abnormal for young people to party and go out and drink. So I would say that it's just a normal part of the culture, and I did grow up around a lot of it. But like I said, it wasn't super. It wasn't affecting me in this way until very recently.
Okay. So now I'm just gonna ask you a few questions about how you feel on a day-to-day basis. Do you find that you crave alcohol throughout the day?
Yeah, I think so. I guess you could say that, because during work, all I'm thinking about is which bar are we going to? Is my favorite bartender going to be there? So I don't know if it's really associated with the social atmosphere of it, or if I'm truly craving the alcohol, but I do think about it quite a bit.
Okay. And then would you say that you've had any like headaches or tremors or even just changes in your mood when you're not drinking for certain periods of time?
I have noticed if I go 2 days without drinking, I do start to get a headache and pretty cranky. People have noticed.
I'm going to just now be asking you a series of questions that fall under our CAGE criteria, and these questions are just designed to help me understand a little bit more about your drinking habits and whether they may be affecting your health. So just take your time on answering these questions, and then there's no right or wrong answers, okay? Okay, so have you ever felt the need to cut down on your drinking?
Until today, honestly, no.
Okay. Alright, and then have people annoyed you by criticizing your drinking?
I mean, there have been comments here and there, especially as of late. I wouldn't say I'm really annoyed by it, but I think people are definitely noticing.
Okay. And then have you ever felt bad or guilty about your drinking?
A few times, yes. For example, if I have a heavy night of drinking, I go to work in the morning and I'm clearly, hungover, and so I do feel kind of guilty about showing up and presenting myself that way at work. It can be a little embarrassing.
Okay. And then and this is the last question, have you ever needed an eye opener or a drink in the morning to get you going?
I typically don't drink in the mornings because of my work schedule, but there have been times on the weekends where I will start drinking fairly early because I can.
So thank you for that. So based on your answers to the questionnaire, it does seem that you have some alcohol dependence, and this is supported by your cravings to alcohol, and then just some of your symptoms that you're experiencing when you don't drink alcohol. Those can imply or indicate some signs of withdrawal. So given the amount of symptoms that you have, you do fall in the category of moderate substance use disorder, and which I know this can be a lot to take in. Do you have any questions for me?
I guess what do I do about it?
Yes, so there's a lot of things that we can do. Before I proceed with talking about different options, I do want to ask you, do you feel like you have a support system here?
Yes, however, my support system is also who I go out with. So I think it's going to be an adjustment, but I think that they will be supportive of me making this, especially, with the accident that happened, I think it's kind of eye-opening for maybe all of us, maybe not just me. So I think I can have their support, and I'm pretty close with my family even though they're overseas, so I can always talk to them, and they've helped me through a lot in the past. So I think I'll be okay as long as I'm, you know, upfront with everyone about my situation.
Good to hear that you have people around you that can help encourage you and help make changes in your life, and if you can also help them do the same, that's also a plus. Now that I have all of the information from you, which I really thank you for being vulnerable through this whole process, I'd like to put you on a medication. And this medication is called naltrexone, and it just kind of helps to decrease your cravings for alcohol. When you start taking this, you may experience some side effects such as like abdominal upset or increased daytime sleepiness. But of course, if you end up experiencing these and they've just become too much to handle, you can always contact us and we can talk about other medication options that aren't causing such bad side effects to you. And then on top of the medication, I'd also like to refer you to a counselor. This counselor will just kind of help to discuss your drinking with you a little bit further and come up with strategies that you can implement into your daily life that can help you cut down and then just prevent any serious medical conditions that can result from drinking. Catching this early and you wanting to make this change at a young age is very, very beneficial to your health, and you know, it's something that I'm proud to have patients that are like you, that can be vulnerable and you know, like to take matters into their own hands. And I do appreciate you know, being as vulnerable as you can through this process, because since you are so young, you are preventing serious conditions that can affect your health seriously in the future. So from this treatment plan, do you have any other questions for me?
I don't think so. I guess no, I think you explained everything very well. I appreciate all of your help. And I hope I can do well on this medication.
Yeah, and I'm here for you every step of the way, so if you have any other questions, you can always just call us, and I'm happy to answer any questions that you may have. So I am also going to recommend to you that you follow up with your PCP in about a week, just to kind of see how you're doing and if you come into contact with your counselor.
Okay.
But other than that, that is it, and I really thank you for this visit. So based on my patient encounter, the patient was diagnosed with moderate alcohol use disorder based on her increased amount of drinking over the last several months, her cravings, her tolerance, and her withdrawal symptoms that are experienced after going several days without drinking. The patient also scored a 2 on her CAGE questionnaire, which is clinically significant for some type of alcohol use disorder. And since the patient is pretty young and she had a recent accident as a result of her alcohol use, her condition is considered to be pretty severe, not only in the short term, as this can put her at risk and others at risk for future accidents, but long term as well, in causing potential liver disease or cirrhosis in the long term. And according to the patient's history, it's pretty evident that there are several factors that are contributing to her alcohol use. The patient stated that she recently moved to the country on her own without any family or friends, which can be pretty stressful to do, especially when you're figuring out where to live, finding a new job, and just the financial implications that come with all of those things. So she did mention that her support system is her coworkers, but she did mention that she also parties with them as well. So this not only could make her feel the need to drink in order to keep those friendships and not be alone, but if she does consider making a change to stop drinking, she may fear that if she doesn't drink, she could lose those friendships. So that is also something that needs to be taken into consideration when coming up with a treatment plan for the patient. So the patient also mentioned that she has a history of alcohol use from close family members, which could also play a part in the patient's views of alcohol. and drinking in general. So for example, she did mention that in drinking in Europe is pretty common at a young age. So it's possible that presentation of even mild to moderate symptoms of alcohol use disorder are just seen as normal to her and other people in her family. So taking the steps to make change for that may be delayed, and it can put them at risk of injury, developing medical conditions in the future. So this whole idea of drinking at a young age can just be seen as something that's normal, and can help, and the patient may develop this idea that if my family's drinking and they think and it's okay for me to drink at a young age, then it's not as bad. So this idea can also just contribute to the patient not seeing drinking alcohol as bad. So all of these factors are definitely contributing to the patient's symptoms, and it's important to consider all of them when developing the patient's treatment plan. So just comparing this interview to the last interview assignment that we did, I do feel like this one is a lot more personable, and it allows us to engage better with the patient rather than just going through some questions with them. I feel like I was also able to gauge at what a patient interaction would look like when you're getting to know more about the patient's day-to-day versus just them coming in with an injury or they're feeling sick and you just kind of ask questions just about that and just get them treated, and you just kind of go through those motions. It was really nice to just try to get to know a little bit more about the patient. So I feel like I definitely still need to work on my ums and my stuttering when I'm nervous. I think that would allow me to be more clear and have a better form of communication with the patient and just streamline the visit a lot more. I do feel like this interview was pretty detailed and very thorough, and I apologize if it was kind of long, but I do feel like the questions that I asked were necessary in order to get a full gauge of the patient's history and just all of the types of factors that are contributing to her alcohol use. I also took some time at the end to acknowledge the patient's strengths in asking for help and just asking for help with her alcohol use. And I told the patient I was proud of her, and I was proud when I have patients like her, which can be seen as a form of encouragement by the patient in her taking the correct steps to improve her health. And overall, I do feel like I was pretty respectful in asking the patient's pronouns up front and thanking the patient throughout the visit for being vulnerable with me so I could help make her feel more comfortable throughout the visit. Some things that I do think that I definitely could improve on top of my ums is just being more mindful of the words that I say, because there were definitely some instances where I was discussing with the patient and I kept saying substance abuse instead of substance use. So even just that, even when I'm presenting to a patient and I just say abuse, it can be taken as an insulting term and can close patients off right off the bat. And I think I did that right when I was meeting the patient in the first couple of sentences that I had with her. So being more mindful in how I frame those words is really important, just so I can make sure not to cause the patient to close off to me right off the bat. So overall, I think that it's really important to create a safe space for patients regardless of their mental health issues or their substance use issues. It's such a crucial thing for a visit that can completely deter or encourage a patient to seek help. So as providers, we need to be mindful of how of our nonverbal communication and just like the way we frame words. And I feel like these video assignments have really allowed me to pick up on what I say and how I say it. Even if I'm presenting myself as being non-judgmental, a simple word of me just saying abuse and use, which sounds so similarly altogether, can completely deter a patient from and cause them to close off during the visit. So that is one way that is the main way that I can see myself in improving my communication with patients in future interactions.